You lovely lot. I am 2 minutes late for this live. I don't know if I'll be able to see any comments, but I'm here, and that is a miracle in itself because tech has literally nearly taken me down today. I am underneath this serene background. It's chaos down here because I don't know whether you can see. I've just had some air conditioning fitted. So we have just two rooms in our house that are really hot when the weather is hot. And mine is the hottest because my office is at the very top of our house. And it is like a furnace up here. Not today, but it is like a furnace on hot days. So we finally given in. I've had air conditioning fitted. So I've been trying to work. There's been rubble. There have been drills. There have been men walking in and out to sort out holes in the wall. And now here looks okay. Down here, all a bit chaotic. But I'm here, and I'm just here essentially to cover a few basics and to remove that mask that we have around menopause. So many people on this page are doing such a good job of trying to manage their menopause symptoms, and it's a very individual thing, which I know I say all the time, which is bloody annoying, I know, but it is a very individual thing. But there are some basics as well that we need to know and we need to follow in order to take control of our hormones. Tech has nearly taken me down, as I said a minute ago, and what I wanted to do at the end of this live was I really wanted to say, click this link and here's a free download. Well, the link is pissing me off. It's not working. So I'm going to get somebody to help me with that because I'm losing my mind, because it's not my area of skill. My area of skill is helping people with menopause and HRT challenges. I don't care about tech. I don't care about links. I hate them all. And I just want to boil my head when I have to deal with them. So what I'm going to suggest, and I'll remind you when I've stopped talking, is I want you at the end of this or during this video, this live, or if you're seeing this on replay, put hashtag replay, and if you could just comment the word bloat. Clue, the download, the free download is about bloating, is to banish your bloating, because I'm going to refer a little bit to gut health as well. And that all comes under the menopause banner because I'm a nutritionist as well as my women's health practitioner side of things. So in case you don't know who I am, my name is Jane Pangborn. In case you are new to this page, I am the founder of Menopause or Not Mad. There are a lot of new people following me at the moment, which is super lovely. I am so privileged. I reckon in the last 2 weeks there's been nearly 1,000 new people, which, bearing in mind I've got 14,500 and I've had that for a good few years, that's quite a big percentage. So thank you for following me. Hopefully I won't be too annoying because I talk about HRT a lot and I base everything I talk about on lived experience, personal experiences, experiences of my clients, and all the research and years of professional work that I've been doing in this space. So I'm the founder of Menopause or Not Mad, best-selling author of I Choose Menopause. Obviously I've got it behind me, why wouldn't I? And Meta awarded for my community work in the online space. So that's all that out of the way. Hopefully you're still watching and you're super happy still to be here. I'm going to just look at my phone as well, because if I look at my phone, if you do comment, then I can actually see it. Sadly, the tech gurus of Facebook seem to stop me seeing what I need to see on here. I don't know why. Sometimes it pops up, sometimes it doesn't. Oh, it does say that I'm live at the moment though, so that's a good sign. But essentially, we're going to talk about the basics of menopause. So if you're brand new to this page, you may know nothing about menopause. You may think you know stuff about menopause because you've been told by people, but you're not sure. Or you might think you know everything about menopause and you don't know why you're even listening to me. All of those things could be true. So I have got a few notes, but I'm going to try just to remind me really of what I wanted to tell you, but I'm going to try and start at the beginning. And comment if you've got any questions, and if I can see your questions, always assuming I can see your questions, then I will comment. I can see a few of you are on live, but yeah, it's not really showing me anything other than people are here. So in terms of menopause, I'm going to try and do this without my notes to remind me. In terms of menopause, this might sound really basic, and it is basic, but still even many doctors who see my clients and my community do not know this. So one of the myths that we are often fed is you can't be perimenopausal if you're still having periods. Well, many of you will know what a heap of tosh, that's the word, tosh that is, because perimenopause is that time before your periods completely stop, and it's that sort of run up to full menopause. So if you're still having periods but you're having symptoms that are unusual to you, whether that's a low mood, itchy skin, low libido, erratic periods, whatever it is, one of mine was anger issues, which I do mention in my book, then yes, of course you can be perimenopausal. And if you're perimenopausal, you can, if you wish to, replace your hormones and level your hormones out with hormone replacement therapy, also called menopause hormone therapy. So it's either HRT or MHT. And I think they're just about to rename it again, but let's not confuse the situation. So if you're perimenopausal, many women are often told, if you're perimenopausal, you can't have hormone replacement therapy, HRT. You have to wait till you've been period-free, menopausal, for at least 12 months. Again, total nonsense. Please, please, please do not listen to that, because the earlier you can start replacing your hormones and topping up your hormones and balancing your hormones, the more benefit you will receive from it. If you wait until you are in your 70s or your 60s, probably you'll be told you're too old anyway then. You're not, by the way, but that's what you'll probably be told. You're either too young or too old. You know, if you've ever seen the Barbie film, it's like you're too thin, you're too fat. You know, you can't win either way, depending on who you talk to. But if you wait 10 years or 5 years post-menopausally, so when your periods have stopped 5 or 10 years on from that, yes, you can still take HRT and there will still be benefits to you. However, there are fewer benefits. That doesn't then equate to it being the menopausal hormone therapy, HRT. That doesn't then equate to there being a higher risk. Fewer benefits does not equal higher risk. So it's important to remember, if you decide you want to go on HRT, you want to start HRT, you want to talk about HRT, you want to consider HRT, it's important to be at least armed with that information before you go to the doctor and say to that doctor, I would like to consider HRT. And if they come back to you and say, oh no, you're too young, you're too old, you're too this, you're too that, your response could be something like, I hear you, I would still like to try it. If they say, oh well, and this is one that has been said to me many times, or said within my community many times from medical professionals, you'll definitely be at really high risk of breast cancer if you take hormone replacement therapy. Please do not believe the hype. Do not believe that scaremongering. Up-to-date studies evidence that is not true. So you will not be at a higher risk of breast cancer if you take a good micronized and body identical transdermal HRT. I'll tell you what that is in a minute. There is a slightly, evidence to be a very slightly increased risk of breast cancer. And I mean slight, less risk than if you drink a glass of wine a night. If you take the, excuse me, if you take the synthetic progestins, like the ones that are in the mini pill and the ones that are in the combined patches. Now, don't now start panicking that I'm on the pill, I'm on the patches, I'm taking the combined tablet, which has the synthetic progesterone or progestin in it. It's still a good option, and it's massively better than not taking progesterone with your estrogen as well. Because if you take estrogen on its own, and I'm giving you a lot of information here, but you can always rewind this and you can always play it back. If you take estrogen on its own, it does give you a significantly increased risk of cancer of the womb, of the uterus, because it allows the uterus lining to over thicken. So the progesterone comes in and thins things out. So estrogen boosts the thickening of your uterus lining, which is it's meant to, and then the progesterone comes in and thins it, and so you get this nice balance. So if you're taking estrogen, and I have had clients who have been on HRT I had one lady that's at HRT for 18 months, and she came to me with some problems with bleeding and said, I said, okay, so, let's just talk about what HRT regime you're on. She said, oh yes, I'm just on the estrogen patches. And I went, okay, yeah, and so what's your progesterone? Oh no, I don't take progesterone. So her clinician had just decided that estrogen was all she needed and she didn't need progesterone. So my first direction to her was, let's just send you off for a scan before we do anything else. Go and have your scan. Let's just check everything's okay. No point in frightening her any more than that. She was actually fine. It was okay. Introduce the progesterone to keep the uterus lining thin. So if you're taking a synthetic progesterone, that's absolutely fine. It's a very slightly, and I mean slight, increased risk of breast cancer. But like I say, no more, in fact, less than drinking a glass of wine every night, being very overweight, smoking, all the things. So, or not taking exercise, that was the other one. So try to feel reassured by that and put it into perspective. Sadly, the headlines are that HRT gives you breast cancer still 23, 24 years on after we were told it, and it was not true then either. So although it's not a sexy headline to say, there's a very slight increased risk of breast cancer with synthetic progesterone, not estrogen, but synthetic progesterone. And in fact, it's a higher risk with a glass of wine a night. That's not a very sexy headline. That's the truth. Those are the facts. So please, please try not to panic and think, I'd rather do this naturally. I'd rather not take HRT, because your hormones are really natural, and the HRT that you will be prescribed is as close to your natural hormones as it possibly can be. And it really does help your body to function effectively. It helps your brain, it helps your heart, it helps your bone. Your bone health is massively improved. Your heart health is massively improved when we add that estrogen and the progesterone back in, mainly the estrogen in this case, but a progesterone has its benefits too, other than uterus health. So I wanted to talk to you a bit about, sorry, my screen just went a bit odd. Oh, Sarah, there you are. I can see a comment. Sarah, your doctor says that you're too young at 39 and it's too early for her. Okay. Well, you would be classed as premature perimenopause, but I started perimenopause at 37, 38. It is really, really common, even though it's classed as premature below the age of 40, to start having those perimenopausal symptoms. As long as everything else has been checked and everything else is, tickety-boo. They ought to check your thyroid, by the way. Then there's absolutely no reason why you couldn't be perimenopausal. And the guidelines are very, very clear that you should be assessed on symptoms. And if you're coming to the doctor with an array of symptoms, by the way, I would suggest that you go to the doctor with your sort of top 3 symptoms rather than just give them a list of random symptoms, because then they're trying to sort of piece it all together in that 10 minutes they've got with you. So be quite laser focused on what you want to achieve and what you want to say to the doctor. But regardless, if you know you've got an array of symptoms and you think you're perimenopausal, they should be treating you as if you're perimenopausal. Obviously testing for other things as well, like thyroid, because thyroid and vitamin deficiencies are common as well at sort of early 40s, late 30s. So it's definitely worth having a sort of full blood panel just to kind of check that. And they should potentially check your hormone levels as well. But if they're going to check your hormone levels because you're young, They can't just do one blood test. One blood test is not going to make a full picture. All that does is give us a snapshot of that time, that minute, that hour, that day, and how your hormones are behaving that day. 5 minutes later, you could be all over the place again. So I did actually have two clients, a very, very similar situation. And to demonstrate that point, they both had blood tests. Both were perimenopausal, 100%. I'd sent them off for blood tests. One of them, they had them similar times, but one came back as normal, no action required. The other one came back as perimenopausal because her hormones were low. And they were both pretty much in exactly the same hormonal situation, but it's just slightly different times of day, and they're obviously different individuals. So they'd given completely different results, but they were both perimenopausal. So, you know, try to be a bit feisty with your approach to this. And I'm not saying argue with the doctors. I'm not saying cause a scene or be a pain, because the doctors have a job to do. Completely get that. And they are trying to do a job with their hands tied behind their backs. But if you go to the doctor knowing what you want, knowing what you can have, and knowing what's going on for you, or a little bit more about what's going on for you, that will massively help them to help you. Oh, Mandy, hello. Do I need progesterone after my hysterectomy? A month ago. Sorry. Currently just on estrogen. Good question. I also had a hysterectomy a few years ago. And the stock answer would be, and I will pad this out because there is more to it than this. The stock answer would be, no, you don't need progesterone after hysterectomy because you don't have a uterus lining to protect. However, there are a number of reasons why you would need progesterone. Some women really benefit from progesterone, and there are more and more studies and much more evidence out these days that shows progesterone has a massive benefit to our bones, our brain, our heart health, everything. But some women really benefit from progesterone in terms of their sleep and their mood and just that hormonal balance. So if you're one of those, absolutely add in progesterone. There's no additional risk if you add in the Utrogestan micronized progesterone tablets, or if you're in the States, it's called Prometrium, and there are various generic versions of the same. Now, another reason to have progesterone, as I would say, as an absolute definite, is if you had your hysterectomy due to having had endometriosis, because endometriosis is fed a little bit by estrogen. So when you're taking your estrogen, you're kind of potentially putting yourself at risk of that endometriosis growing back somewhere else in the body, which does happen. So if you continue to take progesterone after your hysterectomy, that actually calms things down and mostly stops that happening, and certainly negates the risk a little bit. So again, a lot of people are told absolutely not. It's high risk if you have progesterone after your hysterectomy and you don't need it. That's not true. There's not a high risk. You don't have to take the synthetic progesterone, which has that slightly increased breast cancer risk. You can take a really nice, safe micronized progesterone that might help you to sleep. It might help your mood, and certainly will help you stop that endometriosis regrowing. So I hope that answers your question, Mandy. And as we've talked a little bit about the detail of HRT, I hadn't really planned to talk about HRT as much, but I seem to have got off on a roll. Anyway, I'm on a roll now, so let's do it. Ask questions if you want to hear about anything else, and I'll very briefly mention gut health before we finish, because I want you to have that in your head as well. So just a little bit about the types of HRT, because I know people are really confused by that. Oh, and by the way, before I forget, because I always forget this, could you please, if you see this live or if you see this on replay, please offer a reaction. So either a like, a heart, please don't put a hate, although actually they go quite well. The hate buttons, the hate reactions really help the algorithms, but don't do that because I wouldn't be able to cope with that. A little reaction or a comment really helps everybody else to see this. Otherwise, the algorithms don't push this video for anybody else to see. Anywho, so as you're, if you're worried about the sort of HRT that you should be asking for, it depends which country you're in. So some brand names will vary. I'm in the UK. Most of my clients are in the UK. I've got, on my books, I've got about 1,200 clients, and there's about, I don't know, 20% of them are in the US, and then 10% of them are in other countries, so over about 100 countries, but mostly UK. So in general, your choices are a gel, patches, tablets, or a spray, not in any particular order. And you can have combined tablets and combined patches. When I say combined, that means you've got both the estrogen and progesterone together in that patch or in that tablet. And the type of regime will vary according to what stage of menopause you're at and what your needs are. So for example, if you're not having periods anymore, you will need to take progesterone every day. But some women who are still having periods might need to take progesterone every day. So it does vary. But as a sort of standard, and not that there is a standard, but just I can't go into all the individual things here. I do in my book, by the way, just saying. Available on Amazon. If you're having the gel, I haven't got it here, which would have been helpful if I'd got it out. Let me just look in my little secret stash. Oh, here we go. My little secret stash, just like Blue Peter, one I prepared earlier. There's my estrogel. So there's nothing much in this. I think it's empty. I don't use this anymore. This is available not just in the UK, but essentially a lot of the women on HRT in the UK use this. And for your information, this is what's called transdermal, goes on the skin, outside of the arms, inside of the thighs, or on the bottom, or on the abdomen. And when you push this down, push the pump down, that's one measured dose. So when we talk about pumps, like 1 pump, 2 pumps, whatever, that's what we mean. And little top tip, in case you didn't know, when you push it down for the 1 pump, I'll see if I can get some out actually. I'm just going to see if I've got any tissues. I don't want to have gel all over me. So I don't think much is going to come out, but it just comes out. Oh, that's not a full pump. I think that's it there. That's about a full pump. So that's about a full pump. It comes out. Do you know what? I do this all the time, and my right hand must be so estrogenized. It must be so much plumper than the other. Anywho, so 1 pump of that is all good. That's a low dose, but you need to make sure that that goes all the way to the top before you press for the 2nd pump. I've now covered myself in gel. Luckily, I'm on my last tissue. So the gel is really good, really popular, and I like it purely because it allows you some control over the dose. So if you do need to increase slightly for whatever reason, not that I'm suggesting you mess about with your dose, then it's really easy to do that with this. So the gel also comes in sachets or little packets. Just going to look in my little secret stash. It's not that I have a hoard of HRT here, but I have a hoard of HRT here. Sandrina. If you're in the States, Sandrina equivalent is actually called Divigel. Various doses. We don't just go into the detail of the doses, but you've just seen what 1 pump of that looks like. Well, Sandrina or Divigel, I think Divigel comes in sachets. I can't remember now. I haven't seen it for a while. Comes in the sachet. This here, this sachet here, and you can see I've just squished it. So that's how much gel is in, oh, everything's backwards, is in here. That is the equivalent of 2 pumps of that. So you can see that this is less gel because it's stronger than this gel. Some people prefer this, some people prefer this. This leaves a bit more of a tacky feel on your skin, this not so much. So the gel is really popular for the reason I've said, but it is estrogen only. So if you're using the gel, please make sure you have a progesterone in place if you've still got your uterus. That might be a Mirena coil. It might be Provera, which is a tablet. It might be the Utrogestan. Oh, I can show you Utrogestan actually. Well, that's exciting, isn't it? What else have I got in my magic little box? So Utrogestan looks like this, and you'll see The tablets look like this. Now, if you're on a continuous dose, taking it daily, it's 1 a day. If you're taking it just 2 weeks of the month, it's 2 a day for 2 weeks. You don't need any more detail than that. So if you were on the gel, you'd need to take these as well. Same with that. However, if you're on patches, it's sometimes easier, sometimes not as easy. Depends on how you view it. So with the patches, if you have estrogen-only patches, it's like having the gel, but it's just in a patch form. I have the patches. I use, let's go into my magic box again. I use, oh, I don't think I've got one actually. I use the, because they're not as available, I absolutely love Estradiol. I use Estradiol, but I'm having to use the Everel patches at the moment. And anybody that knows the Everel patches will know they're bigger. They're sort of that sort of size for the dose I need. And I find that it makes my skin really blistery. I'm not going to take my trousers off and show you, but my skin is really sore at the moment because round the edge has become like sort of eczema-like. It's not great. But some women are absolutely fine with it. I just don't like the glue that's on the Everel patches, whereas the smaller Estradiol patches, no problem at all. It's just they're not available to the end of the year, the ones I like. Now, I have estrogen only because I've had a hysterectomy and I don't take progesterone. I don't need it. I don't feel a benefit from it. I don't particularly want it at the moment, but I'm open to change if I need to. So if I had a uterus and I hadn't had a hysterectomy, I would put my patch on and I would still need to take one of these or a Prometrium or have a Mirena coil, or there are other ways you can have progesterone, but you don't need to go into the detail of that now. So with patches, there are different brands as well, but you can have combined patches, which I mentioned earlier. Now, combined patches are mixing estrogen and progesterone. It's a synthetic progesterone. It's transdermal, so it's still better and no blood clot risk, which there are with the tablets. But it makes it a little bit easier because you haven't got to take two things. However, if you're taking I'll mention the brand name, Everel Sequi, which is when you're still having periods. Just remember you need to take them in the right order, which is on the box. It tells you what order to take them. Because if you just take them, and I've had some clients come to me with problems with bleeding and erratic moods, and they've said, oh, the HRT is not working for me. And one of the first questions I'll say is, what order do you take your HRT patches in? And I've had a few, well, loads actually, who've said, oh, I just pick any old one out of the box. Well, that will be why there are issues with bleeding or erratic moods or symptoms coming back, because in the Everel Sequi, where you're having progesterone just for 2 weeks of the month, if you don't take them, the patches, in the right order or use them in the right order, you're having 1 day with estrogen only, 1 day with estrogen and progesterone, maybe 2 days with estrogen and progesterone, and then another day with estrogen, depending on what you've pulled out of the box. You need to have 2 weeks of estrogen only and 2 weeks of the combined, the two hormones combined. Otherwise, your body's going, what the heck do you expect me to do? I don't know whether you want me to have a period, whether you want me to just chill out and do nothing. So if you're on a combined tablet or a combined patch, it's really important you take it in the right order. You take the regime in the right order. Oh, I can't see them again. Can't see the, oh, sorry, I can't see the comments. It's gone a bit weird again. Sorry. Oh yeah, Heather. Yeah, does progesterone help with adenomyosis too? To a degree, yes, it does. It's not quite the same, but what you're aiming for is balance. And what usually happens when you're perimenopausal is it kind of aggravates things like adenomyosis, endometriosis, fibromyalgia, all the things, because your hormones are bouncing around all over the place. Sometimes they're really high and sometimes they're really low, and your body is craving that balance. So if we can get you balanced, it's not so much that the progesterone, excuse me, the progesterone is stopping the adenomyosis, it's just retaining that balance for you so that you feel more in control and your body's going, well, thank you very much. I know what to do with this now. I know what's happening. It's a bit like if you've when you've been poorly, people often will say, oh, my HRT's not working anymore, I don't feel well, I'm just going to have to go off it or change my regime. Well, yes, your hormones and your HRT will likely have been affected because your body's struggling to recover from whatever has been wrong with you. Or if you've had surgery, a hysterectomy as an example, but any surgery, or if you're taking new medication, your body just needs time to settle. So because it craves that balance. So what we're trying to do is give it that balance by saying, okay, well, here we are. I know you need a bit more estrogen. I know you need a little bit more progesterone. And we're just going to give you that. And I know it's a little bit trial and error, but we're going to go back and forth until we've got our perfect mix. Having said that, just to put a spanner in the works, that perfect mix will change, of course, until you're fully menopausal, because you're fluctuating all over the place for a good number of years. But as long as you're aware of that and you know why you feel the way you do, you can deal with it. Because a lot of that stress and anxiety is caused by not knowing and being frightened by what's happening, understandably so. And a lot of women will go off their HRT or not take HRT purely through fear of the unknown or fear of something that's happened. And I completely get that. I've been in that situation. I understand, but it's important that we try and remove that fear of the unknown. And that's obviously what I try and do, is remove the fear of the unknown so that you can go, oh yeah, I do feel really bad today, but oh no, I know why it is. I've just had flu, or I didn't eat very well, or I've got a hangover, or I'm really tired because I didn't sleep so well last night, whatever it is. And so everything's all a bit skew-whiff. I mean, I often find if I've not slept very well, or if I've worked too hard, done too much, I feel terrible the next day. It feels like I'm not on any HRT. When I'm on quite a high dose of estrogen actually, but it feels like I'm not, because my body's going, hang on, there's only so much I can do. You know, you need to give me something back. You need to eat well, you need to sleep well, you know, you need to do a bit of exercise and get out and get some vitamin D from the outside world. So, you know, we do have to take some responsibility for our health as well. We can't just say, well, it's all down to the HRT, because, you know, HRT is not magic. I mean, it can feel like it, but it isn't. So I'm going to have to go in a minute because I've got to take the cat to the vet, which isn't massively important to anybody watching this, but my cat needs her little injection, otherwise she doesn't feel very well. It's like her HRT injection, except it's a pain med for her arthritis. Anywho, let me talk a little bit about gut health. I did want to talk a bit more about it, but just to remind you, the tech hasn't been working for me today. I do have an assistant working for me. She's based in the States, so she'll be having a look at that for me later today, because it's the beginning of her day where she is. But if you're interested in the free download, please comment bloat below. And I will make sure that I get that over to you. I'll get that link over to you. I'll manually do it myself because I can't bear not to make this happen. So for those of you, in fact, somebody commented on my page yesterday that made me realise that many people don't see the link. Those of you who struggle with either constipation or diarrhea or food intolerances, and they've either arrived or got worse in the last few months or years since you became perimenopausal, I hear you, my friend, because I was also that person. And I had years of toilet anxiety and feeling terrible, ended up with a bowel prolapse, had to have that fixed whilst I was having my hysterectomy. So lots of interventions. So if we can avoid that intervention for you, great. If we can't avoid that intervention for you, please do go and see somebody, go and see a specialist who can help you to deal with that, whether that's surgically or otherwise. So gut health is really important. I come from a nutrition background. My very first job was in hospitality. I'm a trained chef who hates cooking. It's a bit awkward, isn't it? I absolutely hate cooking. I studied catering management, but as part of that, we had to study to be chefs as well. I wanted to do front of house, customer service, restaurant work, but they made us study to be chefs. So I qualified as a chef, absolutely hate cooking. So yeah, don't come to me for cooking advice. But I'm really good with the nutrition side of things and have studied since then to be a professional nutritionist. Now, when it comes to menopause, estrogen really helps our gut health and it helps our gut transition. So when you're perimenopausal, postmenopausal, menopausal in general, your gut can really struggle with that transition of food through it, so you find everything just takes longer to get through. Here's a good example of how I knew this was the case for me. I was really struggling with bloating, and so I decided to do a cleanse, a charcoal cleanse, and I did a charcoal cleanse. And you may know that charcoal is black. When it comes out in your poop, it's black, so you know there's charcoal in it. When I'd stopped the charcoal cleanse, I assumed everything would go back to normal. And I noted, I know this is oversharing on a public page, but you know, I don't care. So, I mean, I put pictures of my uterus on the interweb, so why would I be shy about bloating? You would think within 24 hours your poop would go back to normal. Mine did not go back to normal for 5 days, so it was still showing charcoal for 5 days, which made me think, holy crap, excuse the pun, I am not transitioning very well with my food if I'm still holding that charcoal in that I stopped taking 5 days ago. Not healthy, not good, feels horrible. So if you don't know, in case you don't know, estrogen really helps with that gut transition. So it's really important that we get that balance right. If you've got too much estrogen, of course, if things are really, really high and fluctuating upwards, then you might end up with diarrhea, and you'll notice perhaps that just before your period, you might get really upset tummy, have a bit of an upset tummy for like the day before, and that's everything's speeding up, which isn't a bad thing necessarily, it's just annoying. So when you're perimenopausal, you can end up very constipated, and that just makes you feel really low. You can't sleep very well, you feel sluggish, you're holding in all those toxins. Of course, it's important that we eat properly as well. And I know it's bloody obvious, but make sure you're hydrated. It says me, who forgets to drink all day. But, do as I say, not as I do. Make sure you drink properly. Try and avoid becoming dehydrated. So making sure not only that you drink properly, but you drink the right things. Caffeine is not going to help. Yes, that'll stop the bloating because it'll probably get things moving more quickly. But actually, caffeine is quite dehydrating. Caffeine-free is okay. There is a little bit of caffeine in caffeine-free or decaf coffee and tea, but it's not as bad. I tend to have a caffeine tea in the morning. I don't drink coffee, but I have a caffeine tea in the morning, and then I have decaf throughout the day. Otherwise, I'm hanging off the ceiling by the end of the day. But when your gut is struggling anyway because of the low estrogen, we really need to take some responsibility and help with that. So making sure you're hydrated, make sure you're moving. So don't do what I do here and just sit here all day, although I am at the top of the stairs, so I go up and down the stairs all the time. And get out and about every half hour, get up, move about, try and do your exercise 3 times a week minimum. Get your body moving for lots of other reasons, but also for your gut health. In the download I'm going to send to those of you who request it, you'll see some tips on what you can eat and what you should try to do from a health perspective. But sometimes it can be something a little bit more serious. Usually it's something that can be fixed. Of course, if you've got any bowel changes, you need to go to the doctor if you're concerned. But in the main, it'll be something that can be sorted. There are things like, and I had this, a thing called SIBO, which is small intestinal bacterial overgrowth, which sounds horrific. And it's not life-threatening. It's just really, really difficult to get rid of. And it took me 6 months to get rid of it, which involves, you'll have heard probably of the FODMAP diet. I didn't do the FODMAP diet strictly, but it involves restricting foods for a short period of time and slowly reintroducing them. And the aim is, and obviously adding in, some really good bacteria in the form of supplements. The aim is to starve the bad bacteria, the SIBO bacteria, and replenish the good bacteria. Quite often you will have contracted, the wrong word, but you'll have ended up with this through overuse of antibiotics, through no fault of your own, high levels of stress, not eating properly, things like that. Things that happen to us all. I mean, anything could have started mine, but oh my God, it was so uncomfortable. And this one day, I was so poorly. We were abroad, and I was so poorly, I reported to my husband much later on that I had been to the toilet for a poop 37 times. Now, that was the peak. That was when I realised I needed help. So it's important to acknowledge that there's a difference. Make sure that you're safe and that you've been to the doctor to be checked. And if you do have those sort of menopausal gut health problems, yes, I can help. Yes, I offer health packages, but it's not a quick fix. It's not just one consultation. Usually with my gut health clients, I would have to spend 6 weeks with you. I do 6 and 12-week packages. Either of those are appropriate. Probably 6 weeks, we can really, really make a difference. 12 weeks, if you're fully committed to some big life changes, 12 weeks would be more appropriate. You can decide which of those you prefer. If that's a route you want to go down, just message me if that's something you want to do. That was not the purpose of me bringing that up. So if there's any questions you've got about bloating and food, let me know in the chat now or later. I will send you, those of you who request and put the word bloat in the comments, I will send you the link to sign up, and it just signs you up to my mailing list. You can always unsubscribe, but it'll just give you access to the bloating download. You'll find quite a lot of information in there, but you'll also hopefully learn bits that you didn't even know were connected with menopause. And then, yeah, let's see what happens. Let's see how you feel after that. I'm always thrilled if people contact me and tell me how they feel or how they've changed things. So message me or email me on jane@menopauseornotmad.co.uk. I'm always happy to see what's going on and how you've progressed. It really helps me to help you if I know how my information has been received, because then I can add on more information to lives like this and help people for free. So let me just double check if there's any more questions. You're welcome, Christina. Welcome, Joanne. Okay, I can't read them all. It's disappeared again. What is wrong with Facebook? So hopefully that's been helpful. I better go and take the cat to the vet now. Yeah, just comment below. Please like or love and comment, because it massively helps the algorithms. I think most of the time Facebook hates me, but yeah, if you can do that, that is all I ask of you, and I'm happy to send you that free download. And see you on the flip. See you guys, bye.